Hi, my name is Bruce Arthur. I'm one of the pulmonary critical care docs here at Wooster Community Hospital, and this is the intensive care unit. As with any health system, the intensive care unit plays a safety net role. So when people are very sick, whether from surgery, medical illness, or neurologic conditions, this is the place where they come when we have the most advanced technology and the ability to take care of very sick patients. We've recently expanded to 14 beds for our cardiac intervention program and allowing us to keep people that have had recent heart attacks here in Worcester after they've had their stent placed. The goal has always been to try to keep people here in Worcester, keep them in Wayne County. From a pulmonary standpoint, we now have a scope that can go down into the airway about the size of this pen that has an ultrasound on the end that allows us to get to lymph nodes or places where cancer or infection can go in the middle of the chest so that we don't need a cardiothoracic surgeon. So the ICU Liberation program was a national collaborative of several different hospitals of various sizes. We focused on assessing pain, sedation, the drugs that our patients are receiving, along with increasing mobility and having families involved. We now have family rounds for all our ICU patients at 9 a.m. every day of the year. The care team comes together. That includes nursing, therapy, physician, social work, dietitian, respiratory therapy. We all get together, we round room to room and answer questions for families. So that's worked out very well. We've also worked on trying to increase our mobility. So we now have patients that are on a life support device and they're up and walking around. So we've had patients that have walked down the entire hallway of the intensive care unit. We were able to improve our mobility to the point that we were actually #1 in the collaborative throughout the country. In the end, we found that our time on a ventilator has decreased by over a day, which by hospital standards is a massive improvement. Every day off the ventilator is about 7 days less that the patient is in the hospital system. So this is a big step. We also have found that we can keep patients better pain controlled so that they're actually awake and able to interact with family and participate in therapy. The intensive care unit also serves to help people that have problems from other locations. We've had more and more of the smaller hospitals in the area sending patients to us because of the level of care that we can provide here in the intensive care unit.